Hi, my name is Kwekwe. I am a pharmacist. In this video, I'll be reviewing the medication Voquezna, which is the first medication in a completely new class of acid-blocking medications that is approved in the US. So in the next few minutes, I'll cover what Voquezna is, how it works differently from other acid blockers, proper dosing, side effects, and important safety tips that you need to know. Quick disclaimer that this video is for educational purposes only. It does not substitute medical advice from your doctor. Please do not stop, or make any changes to your medication regimen without first talking to your doctor. Also, just a quick note, I am not sponsored, nor is this an endorsement of the medication. Just important information for you to decide if Voquezna is right for you. So let's start with the basics. What is Voquezna? Well, the generic name or active ingredient is Vonoprazan, and Voquezna is currently the only brand name available in the United States. There is no generic version yet. Voquezna belongs to a completely new class of medications called potassium-competitive acid blockers, or PCABs for short. Now, this makes it different from proton pump inhibitors such as Prilosec, Nexium, or Prevacid, with which most of us are already very familiar. Voquezna is FDA-approved for treating several acid-related conditions in adults. So healing erosive esophagitis, that is acid damage to your esophagus, for up to 8 weeks, or maintaining that healing for up to 6 months. And also for treating heartburn from non-erosive GERD for up to 4 weeks. It is also available in combination packs with antibiotics called Voquezna Triple Pack and Voquezna Dual Pack to treat H. pylori infections. Now, that's the bacteria that can cause stomach ulcers. Now, fun fact, Voquezna has been used in Japan for over 10 years and has been even become more popular than some of the traditional PPIs. The key advantage is that Voquezna can provide 24-hour acid suppression with once daily dosing, unlike most PPIs. You can take it with or without food without affecting how well it works. So talking about how well it works, let's talk about that. Your stomach has special cells called parietal cells that contain proton pumps. For want of a better word, these are like tiny machines that make stomach acid. The final step in making acid requires potassium to bind to these pumps. Voquezna works by competitively blocking these proton pumps. When potassium can't bind because Voquezna has already occupied that spot, the pump cannot make acid. Now, because Voquezna just blocks the potassium binding site, it can work much faster, and you can see acid reduction within 2 to 3 hours of your first dose. Now, what's particularly impressive is that Voquezna provides consistent acid suppression for a full 24 hours, even with once daily dosing. Now, in clinical studies, it showed superior acid suppression compared to the traditional PPIs or proton pump inhibitors. So this more complete and consistent acid suppression means better symptom relief and better healing of acid-related damage in the esophagus. Now, let's talk about how to take Voquezna properly to get the best results. Voquezna comes as 10 and 20 milligram tablets. For most conditions, the typical dose is 20 milligrams once daily. The exact duration depends on the condition being treated. 4 weeks for non-erosive GERD heartburn, 8 weeks for healing erosive esophagitis, and up to 6 months for maintaining that healing. Now, here's one of the great advantages of Voquezna. You can take it with or without food. This gives much more flexibility compared to most proton pump inhibitors, which usually have to be taken on an empty stomach. Best practice is to take your tablet at roughly the same time each day to maintain consistent acid suppression. Also, swallow the tablet whole with water. Don't crush, chew, or break it. Now, when it comes to the H. pylori treatment packs, you'll be taking Voquezna with antibiotics for exactly 14 days. It's crucial to complete the entire course, even if you feel better before the 14-day mark. All right, now let's cover some important safety information to help you use Voquezna safely. So first things first, before starting Voquezna, tell your doctor if you have low levels of magnesium, calcium, or potassium in your blood, or if you are taking diuretics, what we normally call water pills, as Voquezna can affect the levels of these minerals. Also, if you are taking rilpivirine-containing HIV medications like Edurant, Complera, Juluca, or Odefsey, you cannot take Voquezna as it can interfere with those medications. For pregnancy and breastfeeding, there isn't enough data to know if Voquezna is safe. The manufacturer recommends avoiding breastfeeding while taking this medication, so discuss the risks and benefits with your doctor for your individual situation. Now, if you have myasthenia gravis, a condition that causes muscle weakness, be especially careful as Voquezna may worsen your symptoms. Now, let's talk about some potential common side effects that you might experience with Voquezna, bearing in mind that most people tolerate it quite well. So the most common side effects when using Voquezna for GERD are primarily gastrointestinal in nature and include stomach inflammation, diarrhea, bloating, stomach pain, indigestion, constipation, and nausea. Other reported side effects include high blood pressure and urinary tract infections. Now, when Voquezna is used with antibiotics for H. pylori treatment, you might also experience additional side effects like taste changes, constipation, or mouth inflammation, which are usually more often related to the antibiotics rather than the Voquezna itself. Now, here are some pro tips to help you minimize the side effects. So number one, taking Voquezna with food may help reduce stomach upset, even though taking it with food is not required. Also, staying well hydrated is a good idea, especially if you experience diarrhea. For headaches, over-the-counter pain relievers are usually fine to use, but just check with your pharmacist for any potential drug interactions. As I mentioned earlier, most of these side effects are mild and temporary, often improving as your body adjusts to the medication. In clinical studies, the side effect profile of Voquezna was generally similar to the placebo, meaning most people don't experience any significant problems. Now let's discuss some potential serious side effects that may require immediate attention. These are uncommon, but they are important to recognize. So for starters, Voquezna can in very rare cases cause acute kidney inflammation, a condition called tubulointestinal nephritis. Now, warning signs of this may include changes in urination, swelling in your legs or feet, fatigue, or nausea. Contact your doctor immediately if you notice any of these symptoms. Now, like any other acid-suppressing medication, Voquezna can increase your risk of a condition called C. difficile-associated diarrhea, which is a serious gut infection. So watch out for persistent severe diarrhea, especially with blood, mucus, or fever. Now, long-term use may also increase your risk of bone fractures, particularly in the hip, the wrist, or the spine. This is more likely with prolonged use or in people already at risk for osteoporosis. Vitamin B12 deficiency can occur with long-term acid suppression, leading to fatigue, weakness, or nerve problems. Remember, as I mentioned earlier, these serious side effects are very rare. Voquezna has been used safely in Japan for over a decade. The key is knowing what to watch for and getting help promptly if needed. I sincerely hope you found some value in this video and it has enlightened you on the pros and cons of using Voquezna. If it did, give this video a thumbs up, stay blessed, and I'll catch you on the next video. Thank you.